Hey, Fred,
Hey, John.
what's up?
How you doing, my best friend?
You're here with me again.
I'm here with you again, and I can't get enough, buddy.
We're going to have a little chat.
Going to have a good chat today. Welcome to another episode of Fred and John Talks. Today is December 22nd.
22. Yeah.
We're just a couple days away from Christmas. And how appropriate that we have here a retired OBGYN who delivered over 17,000 babies in his career. Christmas is coming, and appropriately, John is going to take the lead in talking about this episode, which we're calling Preparing for Baby. So with that, I turn it over to the doctor.
Thank you, Fred.
You are welcome.
I was inspired by this topic by the sermon last Sunday titled Getting Ready for Baby. And I was sitting there in the pew and I was like, oh my gosh, getting ready for baby. I spent 17 years of my life doing babies.
You had 17,000 children.
Yeah. I thought, oh my goodness. So what is this all about? So it brought to mind a lot of things medical. It kicked me into doctor mode.
Sure.
I'm retired, OBGYN doctor, but it kicked me into doctor mode. And I thought, well, you've got to have good nutrition when you're getting ready for baby and preparing. You've got to have folic acid. You've got to have a good diet. You've got to have adequate protein. Pregnant women need to be hydrated.
You can't drink alcohol or smoke cigarettes.
No alcohol and no cigarettes. Absolute period. Zero. And that brings in drugs. No drugs.
Yeah.
So there was a crack baby addict problem for the last 20 years, off and on. It was ebbs and flows.
How sad is that?
Very sad. I mean, it creates problems for the pediatricians and the nursery staff after the fact.
Yeah.
Yeah, it's kind of made me think of all those things came flooding back about the mother-to-be, how she has to get ready for the delivery of the baby. It also makes me think about the place the baby's going to be born. You know, people live in apartments, they live with their parents, they live in homes, and they have desires to make the room for the baby and buying furniture. It's a big deal. It costs money.
Baby shower.
Baby shower.
Yeah.
It costs money.
Is it a boy or a girl? Should I like blue or should I like pink?
The mother to be, I mean, she's full of fears, confusion. You know, what if the baby's not healthy? She has a lot of coaches, by the way.
And I would think first time.
Oh, that's there's more anxiety with first time mothers, absolutely. And what I've found is the coaching is not always the doctor. It's often the mother-in-law. It's like the baby's coming into a family.
Yeah.
It's not just her baby. And so her mother is often engineering what goes on or doesn't go on.
Yeah.
And sometimes that's a good factor for me.
I was thinking the same thing.
And you have the mother-to-be saying, well, this is my experience and this is likely what's going to happen to you. You know, the mother-daughter thing. Well, it's very possible you're going to have a lot of pain or you're going to have back labor.
Oh, gee, thanks.
You know.
Yeah.
So there's a whole constellation of people with peers, advice from her friends, her girlfriends who've had babies recently.
Right.
And so all this is coming into the one person to sort out. And then they come into my office and sit down for 15 or 20 minutes.
Well, talk off, a topic that's the big event. As the father of three, and, in my mother and father's day, they didn't let the fathers in the birthing room. But as the father of three, those are the three, of the best highlights of my life, being present for this miracle.
Well, that's exactly right. And I'm going to come back to those sort of things when I talk about being the doctor in the whole process. But when I was listening to the sermon, all these issues came up in my mind about just the woman getting ready for pregnancy and the baby and the delivery. It's a scary thing for a lot of women, and they sometimes have guilt and shame about it if they get pregnant out of wedlock or if they get pregnant before their parents or their in-laws had advised them to wait.
Here we go with the in-laws again.
The in-laws. Oh, it's a big deal.
Or as my ex-wife used to say, the in-laws and the outlaws.
Right. There's even there's even an element of loneliness with pregnant women because they're isolated and they're not one of the group again. They can't go out socially like they did before. Right. They have to change their eating and drinking habits. So it's not an easy process for them to negotiate. It really isn't. They have to do, Fred, more like a learn as they go, especially for the first baby. Now, number 2, number 3, number 7, that's a different matter. You know, it just happens, and they don't have the same kind of worry.
It reminds me of my own mother. She had 8 pregnancies.
Oh my gosh. You don't see that very much anymore.
Not anymore.
The statistics for babies now and families are usually 2.
Yeah.
1 to 2, seldom 3.
Yeah.
So I can tell you, I kind of believe it takes a village to even get a baby born because of all those people, the doctors, the nurses, the hospital. Maybe they go to coaching classes to learn how to breathe and how to endure pain. So it takes a lot of people really to get mother prepared for baby. Another interesting fact is that it's really, here's the math. It's really a mathematical equation. It takes 2 people to make the baby, okay? But the baby's in one person, the mother-to-be. And that creates, for the doctor and the mother, a big challenge, a big issue, because whenever you're monitoring this woman, mother-to-be, she has this growth going on inside of her, and both things can go wrong. Both things can have problems. Both things can have big-time dilemmas. So it's important to monitor blood pressure because there are diseases of pregnancy that make the blood pressure go haywire and threaten pregnancy.
And the more I learn from you, both right in this moment, and we've talked over the years, the more I admire people like you who spend their life helping women and delivering babies. That's another miracle.
Thank you, Fred. It's not cut out for every doctor to be an OB/GYN.
Not everybody's cut out for it.
For the night work and everything else. But the monitoring means frequent visits too. And a lot of mothers in preparation for baby don't get the fact that they're going to be seeing the doctor 6 times, 8 times, 10 times, maybe more if they have a complicated kind of pregnancy with difficulties. There are thyroid issues, blood sugar issues, diabetes occurs in pregnancy sometimes. So it's not, when you say getting ready for baby, it's a whole process. Then you have the issue of, okay, I get to labor. Okay, it's preparing for baby, but then labor is a whole different drama. Labor is pain. Labor is bleeding. Labor is kicking, shouting, screaming. I've been kicked before by ladies in labor.
With their legs in stirrups, you'd be kicked?
Pain is a big stimulator.
Well, it's a good thing you don't deliver baby horses.
And the woman, who's going to have the baby often thinks it's going to be smooth and easy, and it is not an easy process. Back in the 80s and early 90s, I'll give our fans out there in YouTube land a little history. There was a time in the 80s and 90s when women really wanted to engineer their birthing process, and they would come to the office with a birthing plan list or birthing how they wanted the birth to go. And this is what they would want to have done or not have done. They didn't want to have a cesarean section, of course, unless it was really, really, really necessary. They wanted to have a natural birth, but they would have a list of the birth plan. And if you didn't really go along with that, or if your group of doctors didn't like the birth plan, change ships, and then they would go elsewhere. I was being interviewed.
On the note of levity, there's a movie called Knocked Up with Katherine Hagel and Seth Rogen. Did you see it?
And
she goes in with her birth plan, and she's a highly...
That's it.
She's a control freak.
That's what I'm talking about.
Great scene, that whole scene when she's giving birth.
Some of that was...
Give me the epidural.
Yeah. That's a way to alleviate pain with a little spinal needle in the back. But yeah, I mean, those years I think have changed a lot into the century. I don't think women are as they're more cooperative about having advice. They do take charge, but I think they're more willing to have the physician as part of the process. Back in the 80s and 90s, sometimes it was a little combative. That this is the way I want the birth.
Yeah.
And if you're not going to play ball, then I don't want to have you deliver the baby. But eventually, the labor, which is painful and has different stages, produces a baby. And when that happens, whether it's by cesarean section or not, bingo, okay? They're in charge. And that's a big deal, you know. All the preparation may not count for very much once you have this baby attached to you day and night, fatiguing you and tiring you out, and hopefully you have a significant other or family member.
Helpful husband and mother-in-laws and mothers.
One of the phrases I used to tell patients whenever they said, I want to have a vaginal birth no matter what. You know, I don't want to have a cesarean section. And I'd say, well, here's the deal. Doctors who deliver babies, they say this following phrase: we can probably deliver the baby and pull that baby out by hook or by crook, but can you push that child once he's out through grade school, grammar school, high school? And will it go to Harvard? No, will the baby have...
Before he's out, they're talking colleges.
Will there be brain trauma and brain damage and difficulty from the delivery that compromises the baby, Fred?
Oh, yeah. That's impactful.
That happens.
That's impactful.
Babies have Erb's palsies, which is a neck and shoulder palsy, and they have cerebral palsy. There's brain damage and brain trauma sometimes that is due to the birth process itself.
And it's irreversible.
And some of that's irreversible. Some of it's around the cord around the neck several times, which is very hard to anticipate in advance. So it's one thing to be successful in delivering a baby vaginally with forceps or another techniques. They have suction cups now that they can put on the baby's head and move the baby out.
Really?
But sometimes it's more prudent to do a cesarean section, and that's the bottom line. Now, I had the luxury, Fred, of practicing in more than one country. You know, I practiced in Australia when I was training, and there, cesarean section was not done that much at all. In fact, breech babies born bottom first, foot first, would often be delivered by the doctor and the nurse in the hospital or at home without doing a cesarean section. And in America,
is that a good idea?
Well, it is. It's a normal process of delivery as long as there's not a cord compression or something.
I thought if they were breached, they were in danger.
That's the American approach. And when I came back to the States and started practicing and training here, my fellow interns were like, "Oh, I can't believe you deliver breech babies. We do those all by cesarean section." And that has to do more with legal issues and liability issues, and the fact that everybody wants a baby that's perfect that can go to Harvard or to UVA or wherever. So the cesarean rate at one point of pregnant women in the States was about 1 in 5.
Wow.
Pregnancy.
That's a lot.
In Australia, 1 in 10. I don't know what that statistic is today, but that was the attitude about cesarean section or versus not having a cesarean section. You know, after you prepare for baby and you get the baby in your hands, what if you become a victim of postpartum depression? That casts a shadow on the family, the mother, the baby's relationship to the mother changes. Sometimes the breast milk will dry up. It can also be a big turn-off factor for the male involved, the father or the significant other. Sometimes they pull away from the baby or they pull away from the mother because they can't handle that experience of the wife.
And this leads into my profession as a mental health and marital therapist, because, you know, when a woman has serious postpartum, more severe postpartum, I mean, you're talking about, they're afraid they're going to kill their baby. And
Yeah.
I mean, this becomes like a temporary mental illness.
They get a lot of irrational fears and behavior.
Oh, and they must be, I can't imagine how horrible they must feel about what they're thinking.
And it's difficult for them to take care of the baby.
Yeah.
Okay. It's almost like they want to try and reject the baby.
Because depression in its more severe forms can incapacitate a person.
It's a difficult situation for the mother once the baby's here, because she's responsible. Primarily, you're talking about the mother always is responsible for the baby.
Yeah.
And it's the labor, I used to say, is the labor of love. Because even though it's painful and there's screaming and kicking and stitches and bleeding, the mother has the prize. And she hangs on to that prize forever. Some women and their children, whether it's a son or a daughter, that relationship and bond between them never goes away. And whether it's a good outcome or a bad outcome.
And we men can't even imagine what that's like.
We can't. I mean, I've had the luxury of witnessing those relationships over time, but yeah, it's a very powerful thing to be able to know that my gene pool and my effort and my background, my family is now channeled into this one little beautiful baby.
Yeah.
So that's some of the things that came in to my mind whenever I heard this sermon. But now I want to shift a little bit over to the physician side of things.
Okay.
And I can say, Fred, as a physician, I am still in awe of and respectful of women who are pregnant. The mothers-to-be, I mean, they're just something else. They have a stamina and an ability to deal with deformed, changed body shape, which a lot of them don't like that. Though some women will say, I'm more beautiful when I'm pregnant.
It brings to mind how some women, when people say, oh, you're glowing,
Yeah.
and they say, glowing, I feel like a cow,
Can't wait for baby to get here.
But there is a beauty about it. To me, pregnancy and especially birth, you're on holy ground. Speaking as a Christian, and of course you are too, you're on holy ground here. This is the creation of a new life. And that yesterday wasn't here and today is here.
Bingo. Yeah. And sometimes the mother-to-be's skin is more reddish and flush. Sometimes they have a better kind of complexion and better outlook. It's interesting, their whole emotional realm of change that goes on with pregnancy. Somewhat to do with the hormones, but it's also to do with increased blood flow and their feeding and eating for two people. And they've got to make sure that they have enough protein and iron and
Right.
that for the baby as well.
Yeah.
Being a doctor of women in obstetrics, Fred, is unlike any other relationship in medicine. There's no other relationship in medicine where the doctor is in charge of two patients in one. If you have appendicitis, it's removed.
Yeah.
If you have ear, nose, and throat problem, you see that doctor, and that's that.
Right.
It's a totally unique relationship, which I really, really enjoyed. I really did. I would say the one negative was lack of sleep.
Yes.
And the beeper.
Why do women deliver babies in the middle of the night?
4 a.m. That's the peak time.
What? That's the peak time? Is there a medical reason for that?
I have no idea. It has something to do with the tides and the moon, and all those old wives' tales are correct.
Really?
About the timing of delivery.
Wow.
And going into labor.
No.
Yep. So it's a fatiguing game to be in. It's not for everybody to be an obstetrician and live on the beeper, because the beeper goes off as soon as you sit down to go to the bathroom. Or you're out with your wife socially at the dinner party. For sure, you're going to have to leave the dinner.
Sorry, gotta go. Preparing for baby.
There's a lot of trust that I found really enjoyable in taking care of women. It's a very strong trust to take care of anybody's body, because it's an invasion whenever you're examining them.
Sure.
and looking after them and taking the blood pressure, etc.
Sure.
So any exam of a human being is an invasion, and so you have to be very respectful of all of that. Uh, I think the last thing I wanted to get into was Dr. Graham's rules. I had some rules about babies.
Well, you got me on edge.
Yeah, one was,
Edge of my seat.
yeah, you ought to be, because I would say to them, is your significant other or is your husband or is your boyfriend going to be able to make some appointments? So I'd really like to meet the other part, the other responsible person.
Right.
And I said, what you do is you ask them nicely. You say, oh, Dr. Graham has this thing. You know, he really likes this. He has a policy of meeting the dads of the baby. And I said, okay, so you ask them that. And if they go, well, I got to finish the football game and I'm going to go get a beer. Or they go outside and kick the tire to the truck. And then you're just like, well, you need to rethink about how this is going to go, you know, after the baby. Mm-hmm. On the other hand, if I tell them that and you talk to your boyfriend or your husband and say, Dr. Graham would like to see you a couple of times for a couple of appointments, and they say, oh, honey, whatever, just tell me the time and the date, you know, and I'll be right there.
That's a good partner.
Yeah, that's a good thermometer. That's a good thermometer. Yeah. I used to tell patients in general to try and work less, travel less. When you're pregnant, Fred, seatbelts are not friendly to the stomach.
Yeah.
And it's a problem for trauma.
Oh, good point.
And so less travel means try and make fewer trips, have other people pick up things, make a trip count, try not to be trapped in an automobile as much as you can, because it's a hazard.
You know, at the risk of breaking your flow of ideas, I've had many women clients who, you know, just, they did not have a support system, you know, they weren't close to their own mother, or their mother had passed away. Yeah. They're on the outs with their mother-in-law, and then they have a husband who's just kind of, you know, half in, half out. These are the women I have felt the worst for, the saddest for, as they prepare to give birth.
You need a whole support system, and transportation is important. Planning just to be able to get from home to the hospital or to the midwife. Yeah. And midwives are very valuable even today in pregnancy. And some women prefer a midwife and delivery at home. And I think that's fine as long as they make a plan B and C so that they can immediately get to a hospital. Because often if a pregnancy goes bad, which we're not going to talk about, but if a pregnancy situation and labor goes bad where you feel heart rate stress, then the baby needs to come out within minutes, not hours. And, you know, the maximum used to be taught that 15 minutes, if you started seeing fetal distress and baby distress that was persistent and lasting, that's going to change the oxygen level in the baby. Then we want the baby out in less than 15 minutes. And so that means very aggressive, rapid surgery to go in and get the baby out. The other kind of rule I would say to them is maybe less physical exertion, maybe don't go skiing as much this winter, maybe not ski. Those are traumatic kind of things. You know, if you're just bicycling and you're walking, that's one thing. But if you're skiing and doing sports that have contact and combat or trauma, I would try and avoid that. I wouldn't do kickboxing when you're pregnant.
To me, those things have miscarriage written all over them.
Quite possibly. Yeah, you don't want to do kickboxing if you're a martial artist.
Nor do you want to be going down a steep slope on skis.
That's correct. So I used to have those kind of conversations with patients. And I would try and lighten it up, too, sometimes by saying, do you watch Johnny Carson? And, of course, this is the era of time when Johnny Carson was alive. They'd say, oh, yeah, I love Johnny Carson. I'd say, well, do you remember this segment he does of The Great Carmack?
Yeah.
Where he puts on the turban.
And makes predictions?
Makes predictions. I think, go into that mode and say to yourself, is what I'm doing safe? Is it safe for me? How will this turn out if I do this? What could possibly go wrong? Yeah. And will the baby be safe? And will the husband or the boyfriend or the father-to-be, how are they going to react once the baby's here? Or now if the baby's here, how is the father and the baby going to react? How is he behaving?
I like this because what you give them is kind of a list of questions that becomes a litmus test for how this is going to go and what you should be expecting. And
yes, because we know, and I'm sure you've seen this in your practice, Fred, that there are many occasions where the male leaves.
Yeah.
And that's because of many, many reasons, that they can't handle responsibility and they don't understand the needs of a baby and of the mother after the baby's here.
May I ask a question?
Financial issues.
Yes. Did you deliver a lot of babies of young unwed mothers? Because right now I have a friend, and they know this young woman. She's 19, she's pregnant, and she's, over the moon about her boyfriend, but her boyfriend apparently sleeps around and is not ready to settle down. But she's pregnant, and she's, a single person with a manual labor job.
Yeah, that's a good way to put it, manual labor job.
Yeah.
Well, for 3 years, I practiced in Baltimore, and I was training at the University of Maryland program for obstetrics and gynecology. I was part of the University of Maryland program. And so I was working in the inner city and also at Greater Baltimore Medical Center, which is out in the suburbs. And I did deliver a lot of teenage girls, yes. And it's, I think that's still an issue today.
Yeah.
And that's a high risk problem, baby, as well for the future of the baby.
Yes.
As well as even going back to nutrition.
More likely to end up in poverty, more likely to not thrive.
Yes. And it goes back to the very beginning of my discussion of what's the nutrition like, and et cetera. So, it's a situation where the mother has to be thinking, like with her radar, about not just the baby, but the safety and all the things around the baby, because finance, transport, etc.
Good rules.
Yeah, one thing I want to finish with, Fred, is I harvested something from labor and delivery in Winchester from the medical center. I gave the medical center a piece of crockery that had babies on it. Would you mind handing that to me? This is, I'll show this to our YouTubers. It's an interesting piece of pottery, and it has babies' faces on it. And I was drawn to this, and here I am, retired, and it's one of my still prized...
Baby. Turn me around a little more. Baby.
One of my prized possessions from labor and delivery, because whenever the new hospital was being built in Winchester in 1990, I came in one night to do some work before we moved to the new hospital out on Amherst Street, and this was on the floor with the trash.
Well,
it was going to be thrown away. And I thought,
I think you told me this story, but I had forgotten.
I said, no way. I gave labor and delivery this important crockery, and I'm taking it home.
Taking it back. That's a good instance of being an Indian giver.
So, Fred, this is a cue for you. We're talking about babies. There's something else going on about babies.
Oh, yes.
Soon, right?
As I said in the introduction, we're 2 days removed from Christmas Eve, and we're going to be welcoming, from a Christian's point of view anyway, the most important birth in all of history. And I want to say a couple of things about that to our listening audience, and
take it away.
I'll take it away. I want to share two things. One, I'll just put in my own words, but as I've often told you, one of my favorite Christian authors, he's a psychologist, therapist, John Eldredge, and I love his books. My favorite is Wild at Heart. And in that book, he talks about, and again, I'm paraphrasing. This is not word for word. He talks about Christmas as, it's a wonderful thing that we hear these beautiful Christmas carols, and, I'll be home for Christmas, and all the warmth associated with it, and all the peace. And that's right out of the Bible, peace on earth, goodwill toward men. And all that is valid. I'm not invalidating that.
Right.
But he goes on to say, but the reality when surrounding Jesus' birth was much different.
Yeah.
It was, as C.S. Lewis said, Jesus was born into enemy territory, the enemy being Satan.
Yes.
And what happened to this couple? They had to flee to Egypt. He's born in a barn.
Riding a donkey.
Riding a donkey in Egypt. He's born in a barn. And, the murderous King Herod is looking to kill him because his power is threatened. And what does he do? He kills all the firstborn males, which became known as the murder or the killing of the innocents, in Bethlehem. Jesus was born into chaos. He was born into a chaotic world. So that's John Eldridge. But to end on a more sort of pleasant note, there's a very popular song which you and I both know. It's called "Mary, Did You Know?" I remember when I ran this Christian men's support group for 8 years, 2004 to 2012. And one of the fellows who came all 8 years, he was a very good musician and singer. He played the guitar and sang. He played a mean piano. But we used to go on 2 retreats a year, and summer and winter. And in our winter retreats, he would bring his guitar, and he'd play a lot of songs, but the main one we were all waiting for was "Mary, Did You Know?"
I heard Winona Judd sing this on television the other night.
And that song has been sung by a lot of different artists.
What a rendition.
But I want to close the session with the words to the song. "Mary, did you know?" Question mark. The lyrics are, "Mary, did you know that your baby boy would one day walk on water? Mary, did you know that your baby boy would save our sons and daughters? Did you know that your baby boy has come to make you new? This child that you delivered will soon deliver you. Mary, did you know that your baby boy will give sight to a blind man? Mary, did you know that your baby boy would calm a storm with his hand? Did you know that your baby boy has walked where angels trod? And when you kiss your little baby, you've kissed the face of God. Mary, did you know? The blind will see, the deaf will hear, the dead will live again. The lame will leap, the dumb will speak, the praises of the Lamb. Mary, did you know that your baby boy is Lord of all creation? Mary, did you know that your baby boy will one day rule the nations? Did you know that your baby boy was heaven's perfect lamb? And the sleeping child you're holding is the great I am. Oh, Mary, Mary, did you know?
Well, you've given our viewers and our YouTube friends a lot to think about.
I think you've given them more, but I just put an exclamation point on the end, and we wish everyone a blessed, holy, Merry Christmas.
As we do.
And as the bumper sticker says, because we're so commercialized, keep Christ in Christmas.
Absolutely. That's a wrap.
That's a wrap.
Thank you, Fred.
Thank you.
Ciao.
Merry Christmas, everyone.
Merry Christmas, everybody.